Tomorrow is a significant day in Lexington's fight against coronavirus. And with the Labor Day weekend almost behind us, health officials are concerned about what a long weekend full of gatherings might do to our case numbers. Evening Edition's Michael Burke explains.
As we say goodbye to summer on this Labor Day 2020, we're reminded of a harsh reality.
It's hard to believe that we've already been into this COVID-19 response for 6 months.
An unfortunate anniversary milestone. Tomorrow will be 6 months since Lexington's first coronavirus case, with roughly 6,000 cases in Lexington, Fayette County alone since that time.
That's over 1,000 cases on average a month, more than 10 deaths on average a month.
Most of the damage coming during the summer months. Now with the summer's unofficial final weekend here, the department is bracing for what September's numbers could amount to.
If you look at the holiday history of Memorial Day and 4th of July, the 10 to 14 days following those, we saw a spike of cases. Labor Day has a perfect storm.
Perfect storm of what's been perfect holiday weekend weather, coupled with the Derby and trying to give summer its usual send-off. But as we reach the 6-month mark, it's not as bad as it could have been.
It's great we didn't have to use the emergency medical response in place like the hospital at the football stadium.
But if we're not careful as the weather begins to cool, the need for those triage centers could arise. The flu is just not to be taken lightly this year. The symptoms are somewhat similar to COVID, and yes, you can get both.
We have heard of national and international cases where people could get both at the same time. That's not anything you'd want.
A 6-month COVID anniversary and 6 months to Groundhog's Day. Ironic, since it's all felt the same since March.
On one hand, it feels like 6 years, and on the other hand, it feels like it's been 6 hours.
In Lexington, Michael Burke for Evening Edition.